Spondy Vlog 6, if you're new here, I'll give you a recap on the last episodes. This is a live medical journey of trying to fix a broken back without surgery. I'm the first person to document this underreported method that alleges to do better than spinal fusion surgery, which is a terrible surgery that most people with condition are forced to receive at some point in their lives. We've been doing this for a couple of weeks now. I have gone to the expert who patented this method. He's supervising my care. I had seen a local provider who was trying to replicate it. That didn't work, and so I had to return to the expert, and I've gone for now 2 series of intense treatments, and I'm actually here now again for my 3rd. So the 6 main updates on this week are going to be what were the results of the last intensive treatment? Did we retain anything? And did we make any more progress? What are the next steps going to be? So why am I here again now? What happened with my local provider? I don't think I gave you guys enough information on that, and I've been asked by a lot of people, should they go to a local provider? So there's some complexity there. 4th, what's going on with insurance? 5, my numbers don't make any sense. What is going on with my symptoms? How am I feeling? I want to report that honesty to you guys. And then the last thing is, what can you do? If you're a person living with this condition watching the videos, or if you're a healthcare provider, how can you get involved? So I want to touch on that. Okay, so really big news about that last visit. I was there for 3 days, and the first thing that we did was look, just standing, what is my retention from the first round? And y'all, it almost entirely held. We did continue more treatment to try to go further, again, because of the very specific form of degeneration that I have with bone on bone contact, my disc being moved to the side and sort of split into 2 pieces. I think I'm a very specialized case, but we basically decided, because we did make more progress, we made a couple more millimeters of movement, but Dr. Curtis actually said, look, this is so specific, I think it'd be best if you came back for a long period of time so we can really get that disc back situated and try to hold things in almost their final alignment. So that's why I'm here again. I just want to give you all some transparency from my local provider who I had to stop seeing. More or less, it came down to that individual, I felt, overstated their ability to perform this technique. They really hadn't done this before, but didn't really explain that to me. It was very much a learning process, which I think was red flag number 1. Had I known that they really had never dealt with this type of case, I probably wouldn't have spent time with them, because I was coordinating conversations with that person and Dr. Curtis. I was traveling back and forth. I was trying to share information between those offices to really teach the local provider how to do it. And the sad reality is he basically wasted a lot of my time. I spent several hours driving to and from that clinic for what was ineffective care, and certain aspects of that treatment were a complete waste of my time, and I was still charged for that. Which is super frustrating. So having gone through that, I don't think I would recommend that folks try to find a local provider unless they're willing to be very cautious and have a hard dialogue with them to say, look, you know, I want to do this, but only if you follow the expert's guidance to a T. So the major update with the insurance appeal is that we have a date. So I plan to show them the imaging that has been conducted of me, pre-treatment, and then all of the different levels of treatment, as well as corresponding reversal. My main goal with this is to establish a precedent so that insurance, Blue Cross specifically, will cover this, because not only is it much cheaper for them to provide this service, it's quite frankly a much better outcome for patients. So I'm thinking of folks who don't necessarily have the funds to take off work and travel to Georgia and to receive this treatment. I'm thinking of them, you know. Insurance should cover this because it's clearly effective. I just want to give a report on my symptoms. I've been asked this by quite a few people. I'm feeling so good, y'all. It's night and day. Anybody living with spondy, especially severe spondy, can tell you it sucks. I mean, it just takes away from your ability to enjoy life when it hurts to sit, or it hurts to stand for too long, or there's certain postures and positions that are just uncomfortable, and you just have this constant, in my case, chronic ache and pain and soreness. It's almost all gone. So in terms of my daily life, in terms of my ability to just enjoy life, move around, I'm a very active person. I thrive with movement, and I've been able to return to so many types of activities, from cycling to weightlifting to swimming. I'm even doing a little bit of very careful rock climbing in conditions where I can't fall. The main thing during this treatment is just to minimize risk of sudden falls, sudden drops, any kind of force that could potentially reverse the treatment. So that is the one caution, but symptom-wise, this is literally night and day. It's giving me my life back. Can't understate that. Okay, so this is the last part of the video for this week, which is what can you do? So if you're a patient living with this condition, I hope to give you a better answer soon, but I would first and foremost recommend reaching out to Better Health by Design, to Dr. Curtis's office, and just having a quick consult. If you have imaging, they can give you a simple evaluation and at least offer you some guidance. What I want to do with this video series moving forward is to support this clinic's ability to scale this out. So we're working with the manufacturer of these tables to actually create a version that people could have in their homes, that they could travel with, that's something that an individual could just use so that you don't have to come and stay in Georgia for a period of weeks. You could theoretically get it all done just with supervision. So if you're a medical provider watching this, especially a spine surgeon, I deeply encourage that you look into this literature, reach out to the clinic, because they're about to publish a 300-person case series on this data. And I think it would be only to the benefit of patients everywhere if we had a couple spine surgeons co-author this to help get that in the literature and get that seen by other peers in this field. I mean, I'm telling you, as someone who's going through this treatment, this is so amazing. I mean, I'm getting my life back. I'm feeling great. It's easy, it's not expensive, and it's so much safer than surgery. So if you're a chiropractor, you should look into incorporating this treatment into your practice. 6% of the population is currently living with spondylolisthesis. That's thousands of people that need help. So I hope that this video series can catch on and that people who were like me can receive this type of treatment, because yeah, I'm literally getting my life back, and I owe the world to Dr. Curtis in this clinic. That's all I got this week, y'all.